Hello, this is Dr. Edna Buckle. I am presenting on the DAANCE study review. I really just wanted to have a presentation where I talked about what is DAANCE, how it can benefit you if you are currently a dental anesthesia assistant, and how it can benefit you even if you haven't started a career in the dental world. So just kind of wanted to get into it. So why take the DAANCE? So the DAANCE stands for the Dental Anesthesia Assistant National Certification Exam. It is an exam that is administered throughout the year for people who are currently dental assistants, primarily those who assist oral surgeons, but also those who assist other types of dentists who sedate patients. So that could be dental anesthesiologists, that could be general dentists who have a higher certification to sedate patients. It can be any number of specialties that put anybody to sleep. So it is the exam that basically goes through the science as well as the functionality of how to assist somebody who is sedating a patient. So how the DAANCE works. The DAANCE works in two parts. There is a self-study portion and then the final exam. Self-study just simply means I've registered for the exam, now I'm studying, and the final exam is administered in an actual testing location. So with the self-study, you basically need to set an exam date. So basically that's your goal date, and then you work backwards. So they have a packet that they give you once you register. And the best thing to do is to do the modules and take the quizzes and basically test yourself and know exactly how you're going to do on the actual test itself. And the final examination is a multiple choice examination that's administered by the AAOMS, which stands for the American Association of Oral and Maxillofacial Surgeons. So in order for you to take the exam, a doctor must sponsor you to take the examination. They must basically say, hey, I know this person, they'd be a good person to take this exam. I've signed them up. So how long do you have from the time you register until you have to take the test? You have 6 months. Now, this might seem like quite a bit of time, but personally for me, if I were about to take this exam, I would schedule it for maybe 4 months from the time that you register, just because sometimes a long extended due time kind of makes you a little bit complacent, and then that's when procrastination really sets in. So you can schedule the final examination, but it is by appointment only. You can't just drop in to the testing center. It's administered Mondays through Saturdays. There's a 9 a.m. time slot and a 1:30 p.m. time slot. But these days of COVID, it very well could be different. It is on a first come, first served basis. So, a word of caution. If you don't take the exam before the eligibility period expires, you do forfeit the application, which means you forfeit the money you paid, and you have to register again and pay the full price again to take the exam. So the composition of the exam, there are 115 multiple choice questions. It breaks it down into different categories, and each category has a certain number of questions with it, which basically means it's weighted differently, right? So for something like basic sciences, which has 15 out of the 115 questions, versus office anesthesia, which has 25 out of the 115 questions, you can definitely see how office anesthesia emergencies are weighted way more. So that might be some place where you might want to put more of your energy. There's also a section called pre-test items, which has 15 questions which are not scored. That doesn't affect your overall score. So let's say you got 100 questions right, 15 questions wrong, and somehow by miracle all those 15 questions were pre-test items, you'd score 100%, even though you did miss 15 questions. So basically, that's how the test is set up. So the composition of the exam, the test is multiple choice, A, B, C, or D. You want to make an educated guess, but just don't leave it blank. You're not penalized for guessing, but leaving it blank doesn't add anything to your score. So let's say you were torn between C and B. If you really feel strongly about one way or the other, just pick one. If you leave it blank, it's not going to help you out at all. So if you need a special arrangement, if you have any visual, sensory, or physical disabilities, you have to request it in writing when you complete the initial registration form. Sometimes they might be able to give you special accommodations, especially for those who have a history of not being able to test well on standardized tests. But you have to let the testing company know when you register, and then you have to let them know again when you actually confirm your schedule. Now, if you need to reschedule, you can do it once for free. So let's say you're getting through halfway through the 4 month time period you've set for yourself, and you're like, man, this just isn't going to work. It's too much to learn. So you want to extend it out by maybe a month or something. So you can change it that one time for free, and after that, if you keep changing your mind, it's $85 every single time to change it. On the day of the exam, you want to get there on time, because if you're more than 15 minutes late, they won't let you in, and again, you forfeit your money. You want to bring 2 forms of up-to-date ID with you. That can be a driver's license, and a lot of times it can be something like a credit card that at least has your name on it. But I have taken in for standardized exams that I've taken in both my ID, as well as the credit card, as well as a letter that has my address on it. I basically take everything that I can that shows who I am. Now, scoring, it's scored as either a pass or a fail. You get a raw score that only tells you how many items in a given category you answered correctly, but it doesn't tell you which specific questions you answered wrong, which can be kind of frustrating if you didn't pass and you're going to take it again, because it doesn't let you know exactly which question. Like, let's say again you were between B or C, it doesn't let you know at that question, hey, you got it wrong because you answered B instead of C. So that part is a little frustrating, but it does tell you where you can put more of your effort into next time when you're studying. So if you don't pass, you can opt to retake the test. You have 30 days after the test to resubmit the registration information for an $85 fee. Now, if you don't submit within the 30 days, you have to re-register all over again like you're brand new. And after you re-register, again, like you're brand new, you have another 6 months from that new registration date to complete the exam, and this time pass. So, recommended resources. The DAANCE study guide that you'll receive when you register for the examination is very good. It has basically everything you need to know in terms of the biology section, in terms of the office anesthesia emergency section. You can also get an advanced protocol for medical emergencies textbook from Amazon. There's the office anesthesia evaluation manual from AMOS itself, and there's also the ACLS manual, because some of the items on the examination kind of correspond pretty closely with ACLS. There are lots of videos online for medical emergencies, YouTube, Khan Academy, and I do have a Udemy and a Teachable course that is coming out soon that basically goes through the DAANCE and goes through how to study for it, what questions might come up, and hopefully it is helpful to everybody. That will be coming out soon, so please look for updates on this video. So basically, this just goes through some of the modules and kind of what they're testing so that you know what you're up against. So module 1 is the basic sciences. So you have the nervous system, subdivisions of the nervous system, cardiovascular or heart system, the anatomy and physiology, the respiratory system or the lungs, anatomy and physiology, endocrine system, and other important organs and systems. Don't let this phase you. Remember, this is 15 out of 115 questions. So there are some that you're just going to get and some that you might miss, but as long as you try your hardest and try to remember how it all comes back to the patient and how the patient body systems are functioning and why it matters, then it really is a little bit easier to remember. So, quiz module 1 example, the soft tissue valve that covers the larynx and allows food to enter the esophagus is called the epiglottis. So that is like an example of a module 1 quiz question. So module 2 is evaluation and preparation of patients with systemic diseases. So this is things like when you do the medical history intake form or your physical assessment and risk determination. So these are mostly things that the doctor who is assessing the patient prior to sedating them will say. Things like, oh, this patient has a history of high blood pressure, so we might want to do these and these things, right? So you want to go through their medical problems like cardiovascular disease, pulmonary disease, because when you your heart's not working, you're at risk. When your lungs aren't working, you're at risk. Those are the two systems where you don't want to see them fail. So we really emphasize it on this test. There are other medical problems that it goes through, and it's all within the DAANCE book. The other medical problems, like pregnant patients, drug-addicted patients, and how that affects any kind of procedure that you might be doing. So quiz module 2 example, a patient who has renal or kidney disease would be expected to have difficulty with which of the following? And the answer for that is drug excretion, or basically getting the drugs out of the body. Because the kidneys are basically the filtration system of the entire body. So module 3 has the anesthetic drugs and techniques, and medications are 100% of anesthesia. You have to know what type of medications, what is anesthesia, why are we administering anesthesia, how these drugs even work, where they work, how the body takes them in, lets them out, what the different types of ways you can give them. Some of these drugs are given through IV, some of these drugs are given by a shot, and some of these drugs are given by inhaled. And then you want to do the math of anesthetic drugs, because you really want to know, hey, if my patient is so and so much in pounds, what is my limit of how much medication that I can give? And so those are the things you really want to know. So module 3 example, oxygen is approximately what percent of room air? And the answer is C. It is 21% really, of room air. So the oxygen that you're breathing, that we think of oxygen all around, is actually less than 1/4 of what we are intaking and expelling in our lungs. So module number 4 is anesthesia equipment and monitoring. So anesthesia equipment and airway maintenance. So you really want to have functioning equipment, because if your equipment is failing you and you're not able to watch that patient, things go really south really quick. And so you really want to make sure your equipment's up to date and that it's working. You want to be able to watch the patient as well. So in our office, if we're doing a sedation, even if it's just the most moderate sedation, it's always 3 of us in the room. It's myself as the surgeon. I have my main assistant who is helping me work on the patient, and she stands with her back to the sedation equipment so that I can view the sedation equipment. And then we have a third person who is basically directly towards the patient and also has a sight line to the anesthesia equipment itself. So my direct sight line is to the patient and the anesthesia equipment. The second assist is to the patient and the anesthesia equipment. And so we're all watching. And so you want to be able to have the things on hand that you need in case things go awry. So you want to have emergency equipment available, defibrillation equipment available, and you want to know what your emergency protocols are. So how often should the function of an anesthesia machine be checked? And that really is daily, because if you are doing sedation daily, you really want to make sure it works every single day. If it's not working, don't use it. So module number 5, office anesthesia emergencies. That can be the lungs, the heart, the endocrine system, which is basically hormones, the nervous system, so things like the brain, the immune system, and any other emergencies that can come up. So quiz module number 5, the use of epinephrine results in peripheral vasoconstriction. So basically, if you are having some kind of allergic reaction, one of the hallmarks is that the lungs will basically close up, and the blood vessels will open up. And so you tighten the blood vessels up so that the blood remains in the circulation, and then you open up the lungs. So it's so the patient can actually breathe, and the blood is going where it needs to be going. So thank you. The online Udemy course will be available. It's actually been pushed to the end of 2020, but it is coming. Please sign up for more in-depth help with DAANCE studying. And I'll have a little email sign up for you at the bottom of this video. All right. Thank you.